Good afternoon. I'm Dr. Bernadette Madrid, the Executive Director of the Child Protection Network Foundation in the Philippines and head of the Child Protection Unit at the University of the Philippines, Philippine General Hospital. And beside me is Kirsten DiMartino, whom you met this morning. So our panel this afternoon will discuss the Philippine Plan of Action to End Violence Against Children and specifically focus on the critical role of the social service workforce in order to implement this Philippine Plan of Action to End Violence Against Children. So we will start this panel with me as your resource person, telling you a little bit about the Philippine Plan of Action to End Violence Against Children and emphasizing why the social service workforce is very important in the implementation of that. And it will be followed by a video of the Undersecretary of the Department of Social Welfare and Development in the Philippines, who is responsible for institution building and child protection. Unfortunately, she can't be here in person because there's a travel ban on government officials in the Philippines from going abroad. And so you'll just see her on video. After her video, Kirsten will give you an overview of the planned mapping of the social service workforce in the Philippines, also in order to end violence against children. So we have until 3 o'clock to be able to do all of this. So. If I can have the slides. Yeah. Okay. So this is the Philippine flag. For all of you who don't know what our Philippine flag looks like. Okay. So why is violence against children urgent in the Philippines? This was shown by the Violence Against Children study done in 2015, showing the high rates of violence against, the prevalence of violence against children in the Philippines, with almost 3 out of 5 children experiencing either physical abuse, psychological abuse, or bullying. And you could also see that cyber violence, in essence, a new setting for violence to occur, also quite high, together with domestic violence. So after this study was done, the Philippines came out then with the Philippine Plan of Action to End Violence Against Children. And this Philippine Plan of Action, or the shortcut for it is PPA-EVAC, is inspired by INSPIRE, which is the 7 strategies that had been shown to work to either prevent or to respond to violence, developed by WHO, UNICEF, the Global Partnership, and 10 other international agencies. And so we looked at these different programs, which has evidence to be either to show that it works or it's promising, and try to see which of these can be adapted in the Philippines. So just to say that INSPIRE, for those who still don't know what it is an acronym for the I is for the implementation of laws, N is for the norms and values that support nonviolent actions, S is for safe environments, P is for parenting support, I is for income strengthening, R is for response services, and E is for educational life skills. I mean, that's just in a short summary. And there are several cross-cutting actions also within INSPIRE, because we know that no one agency or organization can be able to deliver all of these programs. So you need a lot of coordination between different sectors, and also in doing monitoring and evaluation, you need the help of different agencies, be it government or non-government. So if you look at the sectors involved, it's almost like everyone in the Philippines who deal with children is involved in one way or another, either in delivering programs, in monitoring, or in evaluation. Now, keeping this in mind, the Philippine Plan of Action to End Violence Against Children was created, but it took a while to do that because it needed consultation from all of these different sectors in all parts of the country. And the participants in the making of this plan of action included government, non-government, faith-based organizations, civil society, even children and parents. And so after the consultation nationwide, then there was one big national workshop where the results of the different consultations were taken into account in the final development of the Philippine Plan of Action to End Violence Against Children. Now, of course, the framework has definite, it's working towards using these different principles. We know that from the study that violence against children occurs in all levels. In fact, the studies show also that it was the same prevalence across all socioeconomic class, and not just among poor people. And that when we want to prevent violence against children, it means addressing all factors. When we're talking about the Bronfenner socio-ecological framework. And we know that there is no single strategy that works, that we need an array of strategies and interventions at these different levels. It needs involvement of all sectors and stakeholders, and even all government departments, not just the Department of Social Welfare. And we need action from the highest level of government to be able to implement this Philippine Plan of Action. That goes without saying that being able to implement this also helps us achieve several SDG targets, especially 16 and 5, but I'm sure there are others, not only 16 and 5. The theory of change, when we talk about this Philippine Plan of Action, looks at 6 preconditions that has to be there in order to end violence against children in the Philippines, and we call them the key result areas. And these key result areas has what we call the demand side, where you're looking at the beneficiaries for certain services. And key result area 1 is about parents and caregivers being aware of and practicing evidence-based parenting skills and positive discipline towards building a safe, nurturing, and protective environment. And the lead agency for that is the Department of Social Welfare and Development. We all know, however, that it's not just simple to say that you have a parenting program. The key word there is that it's evidence-based, and not all parenting programs are evidence-based. And this is where we looked at INSPIRE, and particularly the Parenting for Lifelong Health. And that meant adapting and doing the research for evidence that it also works in the Philippines. And that takes even just that research in terms of adaptation means, working together with different partners from the Department of Social Welfare, with the University of Ateneo de Manila, with NGOs like the Child Protection Network Foundation, and from there, the next thing you know is that then you look whether you can scale this up or not, and what should be the delivery system for these parenting programs. That's why for INSPIRE, we added a letter D, inspired, for D for delivery systems, because there are different delivery systems for parenting programs in the Philippines. That's why when you look at the supporting agencies, you see again almost everyone dealing with children when you talk about parenting, with local government, international NGOs, faith-based organizations, even the Department of Education, and universities and organizations that have parenting programs. And thing is that there are different parenting programs already existing in the Philippines. So how does one persuade all of these different organizations, agencies, etc., to say that, well, what parenting program has evidence that it would work to decrease, physical violence, for example, in the Philippines. So that's key result area 1. When we look at the next key result area, it's about children and adolescents demonstrate personal skills in managing risks, protecting themselves from violence, reporting their experience of violence, and seeking professional help when needed. And the lead agency here is the Department of Education. Basically, this is about, life skills. And when you look at, again, the supporting agencies to accomplish this key result area, you see here different, again, government agencies and organizations working with the delivery of life skills. And we look at Inspire and look at those different programs and the type of life skills that have been shown to work, again, to prevent violence against children. And we're dealing, same with parenting, we're dealing with different social service workforce, with the different, organizations of the delivering this, like the Department of Social Welfare, local government, NGOs, so again, which of these, all of this workforce would need training and an evaluation of the program to see whether it works or not. The third would be the appropriate and quality protective social, mental health, legal, economic, and judicial services for victims of violence against children. And the lead agency here is DSWD and the Department of Justice. And you can just look at all of these different supporting agencies. I want to say that when we talk about training and you're looking at these different sectors, then the training necessarily has to be multidisciplinary. And it is multidisciplinary, and when you look at the certificate of these different training programs for these different sectors, you could also see that those who sign off on these certificates could be a combination of the Department of Social Welfare or the Department of Health with, for example, the University of the Philippines with the Philippine National Police. You could have, depending on what kind of training it is, then you'll have also multidisciplinary certificate is what we call it. The fourth is monitoring and evaluation. And here the lead is the Council for the Welfare of Children, which is a government interagency body that is responsible for the enforcement and implementation of laws affecting children, as well as the creation and monitoring and evaluation of programs and policies dealing with children. And you could see, again, all of these different supporting agencies. The fifth key result area is that all violence against children-related laws are in place and are effectively enforced. And here the lead agencies, the CWC and the Department of Justice, and the supporting agencies are all partner agencies. And six, this is the multi-stakeholders child protection structures and systems are in place, and you could see again that all partner agencies are involved in this 6 key result area. When you look at now the organizational chart to be able to implement this PPA EVAC, you could see that we have a central coordinating body, which is the Council for the Welfare of Children. But then you could see all of these other government agencies and NGOs, who are all supporting agencies that are being coordinated by this central coordinating body to be able to implement the PPA EVAC. And so we go to why, we need to strengthen the workforce. I think it's pretty obvious that to be able to implement all of those key result areas, you really need to have a very good social service workforce that is planned, developed, and supported. And the 8 key strategies of this PPA EVAC emphasizes that, and the lead agency in this strengthening of the workforce is the Department of Social Welfare and Development. And the way that the workforce will be strengthened begins with the mapping, which will be discussed by Kirsten. The developing part is the capacity building, which, while being led by the Department of Social Welfare, as will be discussed in the video by the Undersecretary Yusek Templa, we also involves all the other partner agencies, depending on what you are training for. And on top of that, we really need to build the supporting structures to be able to have the supervision, the mentoring that has been discussed earlier, for that to happen, as well as to hire and retain, the workforce that has been trained. So I will end with this slide before we go to the video, and just to say that every child has a right to a life free from violence. Thank you.
Conference participants that the Philippines is indeed a pathfinder country, because primarily we have our national baseline study on the violence against children, and all forms of violence against children are covered in this study. Even if it is an initial study, we're able to collect much information that will push us to come up with a national plan of action to end violence against children. We call it Philippine Plan of Action to End Violence Against Children, PPAVAC. Now we have this PPAVAC as our instrument to push for more policies and more responsive programs and services towards ending violence against children. We also want to explore other possibilities of working with other sectors, but we want to focus on those direct service workers. We primarily call them as the social workers on the ground, and these social workers are the targets of the Global Social Service Workforce Alliance in terms of determining how far they have been involved in addressing the issues of children as they work directly with children. Globally, in the Philippines, we have the social workers from the local government units, from private organizations, civil society organizations. The UNICEF and DSWD, the Department of Social Welfare and Development, my department, which is a national line agency, which is a core mandate of evolving programs and services to address issues related to vulnerable sectors. One of them is the vulnerable sector, children, our dear children. These approaches should be reviewed, and we thought that conducting an investigation on the social welfare systems in the country would be a better chance for us, or an opportunity for us to look into the forces that are directly involved in delivery of programs and services to address issues of children. We have decided, the UNICEF and the Department of Social Welfare and Development, to come up with an initial investigation into the conditions of the social service workforce. We have decided to launch the 8-month study to be able to appreciate what are the issues, concerns influencing, affecting the status and position of children as they are facing various issues around the environment, surrounding the environment. So we said that the child protection strategy should be closer to the direct service delivery, and the direct service delivery force, as I have said, is this social workforce. So this study we are launching soon. We'll start maybe end of May, as we are catching up with our colleagues who are involved, who are offering their services through the academe, the University of the Philippines College of Social Work and Community Development. It's very much involved in this exploratory study. So we at the Department of Social Welfare and Development, UNICEF, we have arrived at a decision that we have to focus on the registered social workers who are in the local government units, in public agencies, government agencies. So we are primarily focusing unit of study of this research work, the registered social workers. And it's also very good to consider that the focus would be social workers who are involved in setting up the local council for the protection of children. These are the social workers who are involved in not only in policy advocacy on the ground at the regional. When we say regional, it's a cluster of provinces in the country. So they're not only involved in this, but they are also involved in coming up with programs or services according to the context of their locality. And so we said that this social service workforce, meaning the social workers themselves, should be involved in the process of coming up with the study design. So finally, we have met last February to design the study and the investigation itself. So we are ready by end of May, as I have said, and we want to see the existing policies. We want to examine, assess the existing policies, frameworks, programs and services, so that we'll be able to know what is this policy environment and programs that affect or influence the service delivery, and that how this affect the performance of the social workers themselves. So we want to outline the specific programs and services being delivered by social workers according to their localities, their realities on the ground. And the third point is that we also want to map the social service workforce, the social workers who are in various line of work in various sectoral programs, meaning subsectoral programs, or children of the poor communities, urban poor communities, children of the rural poor communities, children of the working force or labor force. So we have children in various situations in the Philippines. So we want to see the sex disaggregated data of the social workers who are on the ground. And we want to also come up with a strategic framework on strengthening social welfare systems in the Philippines with focus on social service workforce, referring again to the social workers who are involved directly or indirectly in this line of work. I'm happy to also declare that there is a parallel move aside from the joint undertaking by the Department of Social Welfare and Development and UNICEF Philippines. We also found ourselves being involved, me as a social worker, as I have introduced earlier. The professional social work circles in the country are also very much concerned of the practice standards of social work. So practice standards in relation to the professional education standards as declared by the International Federation of Social Workers jointly with the International Association for Social Work Education or Schools of Social Work, and the International Council for Social Welfare, ICSW, IASW, IFSW. These three global partnerships of which is concerned with social work education and training standards declared in 2004 the global standards for social work education and training. This will guide us in our study in examining now the practice standards of social work in the country. So there is a parallel action while we are very busy with how we proceed with our national study on the social service workforce, focus on social workers, registered social workers. We also have this initiative of the three major organizations in the country involved in social work education and training and course practice represented by the Department of Social Welfare and Development. I would like to mention the initiative coming from the Philippine Professional Regulation Commission Social Work Board of Examiners. So they are 5 of them who are very much involved in this initiative and involving further the Philippine Association of Social Workers Incorporated, PASWI, as its acronym. And then we have the National Association for Social Work Education Incorporated, the NASWA. So these three organizations are really very much involved now in this undertaking, examining the practice standards of social workers in the country, and maybe our output would be kind of a recognition agreement, mutual recognition agreement. It can be a tripartite because we have the national agency in charge of social work professional education and training, the Commission on Higher Education. So maybe the Commission on Higher Education Social Work Committee would be very much involved in our final study. So we have 3 major public organizations involved in social work education and practice. So I'm referring to this soon tripartite mutual agreement on practice standards for social workers in the Philippines. So the Commission on Higher Education, Committee on Social Work, the Philippine Professional Regulation Commission's Board for Social Workers, and the Department of Social Welfare and Development. So these 3 major government organizations will spearhead the final formulation of that practice standards, and will soon share this to the world. And the results would of course be a vital material in our finalization of the study on strengthening social welfare systems in the Philippines with focus on social service workforce. So we are declaring that social service workforce, working with them, working with the social workers, improving their engagement with the children to end violence against children, would be a special child protection strategy of the Philippine government in cooperation with UNICEF Philippines. So thank you very much for listening. I hope to hear from you as I will try to be online when you are proceeding with this special event in Washington. Thank you very much. Good day, everyone. All participants to this
Okay, thank you very much. I've been asked to step in for my UNICEF colleagues in the Philippines who unfortunately were not able to travel to attend the symposium. So I really hope I will do them justice. In particular, I would like to thank my colleague colleague in the Philippines, Jess Farr, for developing and preparing the presentation that I am going to give on behalf of the UNICEF in the Philippines. So the focus of this particular presentation will be on the mapping of the social services workforce for better planning, development, and support to that workforce, which the UNICEF Philippines office plans to implement with, of course, with all the partners relevant partners in the Philippines, together with the support of the Global Social Services Alliance and also the UNICEF Regional Office for East Asia and the Pacific region. Moving on. So as Bernie had already mentioned, in the Philippines in 2015 completed their first ever national study on violence against children, which revealed significant levels of violence against children. 80% of Filipino respondents stated that they had experienced violence during their childhood, with 60% of these cases occurring in the home, so being perpetuated by close family members such as mothers, fathers, and siblings. In the Philippines, the primary sort of responsibility for ensuring that social services are in place to prevent and respond to violence against children are the local government units. They have this particular mandate with support from the national government. And of course, these local government units are experiencing quite significant challenges in terms of providing quality social services to address situations of violence against children. There are many challenges that they are facing. The primary challenges relate to training and capacity of the workforce, especially having a trained workforce in the poorest municipalities in the Philippines. Another challenge is the high caseload ratio for social workers, the lack of experience in doing case management appropriately, lack of qualified supervision and guidance, and also lack of funding. These are just some of the key challenges that have already been identified. And of course, as already mentioned by the previous speakers, the focus is really to try, and the aim is to try and strengthen the social welfare system and also strengthen linkages to parenting support programs, especially the MAPA program that is being implemented to strengthen parenting programs in the Philippines and ensure that children are better protected from violence. Why is the UNICEF Philippine office supporting this initiative? As I mentioned also this morning and mentioned by other speakers, under UNICEF's new strategic plan for 2018 to 2021, in our theory of change related to goal 3 of that strategy, which is prevention and response to violence, it clearly states that if child protection systems are strengthened, and if a whole range of things happen, including strengthening of the social services workforce, then girls and boys will be better protected from violence exploitation. So really, system strengthening is at the core of what we are trying to achieve. And social services workforce is at the heart of that. So what we have done together with, as I mentioned this morning as well, we're developing now program guidance for country offices to guide them on in this area of work, together with the Global Social Services Workforce Alliance. We've developed a theory of change which we hope will help to improve our capacity to reduce violence against children by strengthening the social services workforce. I will not go into detail here, but as you will see, basically the logic is that looking from bottom up. If you have strong governance, strong leadership, strong coordination, multi-sectoral coordination, which is really, what we've been talking about a lot today, then you will be in a better position to plan, to develop and support that workforce. And as a result of that, hopefully, we will be in a better position to prevent and respond to situations of violence against children. And of course, the social services workforce can do the work that it needs to do in terms of promotive work, preventive work, direct services, and specialized rehabilitative services. So this is just a schematic, simplified version of the theory of change we have developed to support these efforts. Moving on, again, the social services workforce, as I said before, is seen as, the key ingredient of the child protection system and really at the heart of the whole system. Many of you are familiar with what are the different components of the system. You have the laws, the policies, the financial material resources, the information management, the services that need to be in place at different levels, and different structures and roles that need to be in place, the monitoring systems. But really at the heart of that system is a strong workforce that will drive that system, and that workforce needs strong capacities and needs to be continuously developed and strengthened. So what was, again, the rationale? I've kind of talked a little bit about it already, but what really is the rationale for mapping the social services workforce? One of the key reasons that that UNICEF is supporting the government of the Philippines in this initiative is that, and as you've seen from the previous speaker, is that the government of the Philippines would really like to develop a clear national framework to strengthen the social, as they still call it, social welfare system in the Philippines, to better meet the needs of children and prevent and respond to violence. The government has already taken significant action in this respect based on the findings of the Violence Against Children study from 2015, and adopted their first plan of action on ending violence against children for 2017 to 2022, and is very committed to this initiative. It has also laid out, this plan also lays out what is called a multi-sectoral roadmap, which identifies 6 key results areas and outcomes that are sort of seen as preconditions that need to be fulfilled in order to hopefully be able to reduce violence against children significantly by 2022. Again, these 6 key results areas and outcomes, they relate, these are the 6. They relate, the first key outcome is that parents and caregivers are aware of and practicing evidence-based parenting skills and positive discipline towards their children within their families, and thereby creating a more nurturing and protective environment. The second key outcome is that children and adolescents demonstrate personal skills. They have, more skills and capacities to manage risks, to protect themselves from violence, etc., to report about their experience of violence, and to get and seek the help they need. The third one relates to access to appropriate and quality protective social, mental health, legal, economic, and judicial services, basically the whole range of services that need to be in place at different levels, right down to the community and to the family, to support these situations. The fourth one relates, of course, to monitoring and evaluation, to have a proper monitoring and evaluation system for the plan, to make sure that we track progress, we know where the baseline is, we know what our targets is, and we know what we're trying to achieve, and we can show, hopefully, change and success at the end of the road. The fifth point relates to, of course, the legal framework, having that in place, but more so, beyond that, not only having a legal framework that is clear, but ensuring that that legal framework is appropriately enforced and implemented for children. And then finally, having the structures and systems in place for multi-stakeholder child protection systems to function together. So moving on from that, as I said before, the government of the Philippines is very, has acknowledged and is very committed to the importance of social welfare system strengthening, and they see really the social welfare system strengthening, the social services workforce strengthening as the key pillar of any child protection system. And one of the key components that they are focusing on is the outcome number one from the plan of action, which is really investing in evidence-based parenting and support programs. They have a MAPA program that they are implementing and rolling out very intensively at community level, really providing very concrete support to families in the community to address these issues. Moving forward, the rationale for the mapping is, of course, that UNICEF supports the government to do this mapping. The idea is that the mapping will generate the necessary evidence on what is the current situation of the social services workforce, what are their key challenges, especially at the local level, and especially in relation to violence against children, responding to violence against children. And as I mentioned before, this mapping is not only happening in the Philippines, it is part of a multi-country initiative whereby different countries in East Asia and the Pacific are mapping their social services workforce system, so to say, and it's being supported, of course, not only by the Global Social Services Workforce Alliance, who is providing the technical support and the tools to undertake the mapping, but also by UNICEF regional office in that area. And as Bernie also mentioned, it's part of the bigger Inspire initiative, so to say, where in Inspire, of course, as you are aware, parenting, strengthening parents and caregiver support is seen as one of the key strategies at preventing and responding to violence against children. And of course, the social services workforce is critical in ensuring that this parenting support is provided. And it links again to what I've just said before, the MAPA program, which is a Parenting for Lifelong Health program that is being implemented. What are finally the objectives of the mapping exercise? The key objectives as they've been outlined are to review and assess what is the existing national and local legislation and policy frameworks, the standards, the governance practices related to social welfare and child protection. It is there to assess specifically and map the social services workforce, both the formal and informal sectors, the paid, unpaid social services workforce. This is, I think, an area of particular challenge, defining exactly who do you map when you are looking at the social services workforce, because each country might interpret that slightly different, and how broadly and how narrowly do you define that and look at that. So these are ongoing discussions that we're having. The third objective is to determine the existing and needed technical and resource capacities of the social services workforce. And fourthly is to identify factors contributing to the extent and quality of the delivery of the social welfare and child protection programs and services by the social services workforce. And finally, the idea is to develop a strategic framework for strengthening the social welfare system, and within that, of course, the social services workforce in the Philippines. The expected results, I won't go into them here now because they're pretty much a repetition of the objectives, but at the end of the day, as I said before, the idea is to have a national strategic framework that clearly articulates the way forward for strengthening this particular system. And of course, all of that cannot be done and cannot be achieved without the involvement of all relevant partners, both at the national, local level, the government institutions, the civil society, the academic institutions, and a whole range of other actors that need to be involved to make sure that the mapping is successfully implemented. And to end on this note, a beautiful quote Children are tired of being called the future. They want to enjoy their childhood free of violence now, which I like very much, because we always say children are our future. Yes, they are our future, but they are also now, and now's the time that we need to help them. They're growing up now. So thank you very much. I don't know how to say that correctly in your language, so maybe. Thank you. Thank you very much. Okay.
Thank you so much, Kirsten. Really appreciate that. And we can now open the floor for any question, as well as online. None? Here.
Thank you very much for the presentation. I have a question on the data, the transition from research to practice, especially following the completion of the VAC survey in the country, and your experience with managing that transition, but also at another level, what are some of the challenges or even lessons you've learned from this effort? We saw from the video, the undersecretary, is that the person? She's very passionate about moving this framework ahead. Is that all represented throughout the country? Are there challenges that you're facing, and how have you overcome them? Thank you.
Okay.
Okay, thank you. I was a bit shocked by one of the slides that the first presenter presented about the violence against children survey results in your country, where you reported that sexual violence was higher on the boy child than the girl child. I remember I saw 19.5 for the boys and something like 14.5 for the girls. That shocked me. I had not seen that elsewhere. In fact, for me, in my country, before we did this survey, I even didn't know the boy child was equally suffering from sexual violence. Do you have an explanation to that? Why is it so much higher on the boy child than the girl child in your country?
Okay. Any other question? There.
Thank you very much. That was very incredibly interesting. I was curious about, of course, I have a question for the Undersecretary who may be listening but may not. I believe that she referenced standards that are being developed, implemented well down the road. And so I was wondering if you could speak a little bit more to that. How do you balance out the importance of standards for social workers, I believe was who the target audience is, and the broader social service workforce in terms of standards, competencies, measurements of skill? Are you addressing that more broadly, or do you see that as a next step, or is it part of the discussion around standards? Thank you.
Great question. Yeah, thank you.
Thank you so much for your presentation. I'm also curious because I know the Philippines obviously has been involved in a lot of emergency response and humanitarian context. So how sort of everything you presented thus far supported your response efforts, or how they sort of maybe even strengthened upon them, or sort of what the linkage and synergy is as you continue to develop? Yeah.
Hi, Bernie. You reflected an exceptionally high prevalence rate overall for violence against children, indicating that in the majority of cases it takes place within the family. I would imagine it would be hard to reach data. How did you arrive at this figure? How were the data collected?
I'll start answering the questions. Let's start first from Patrick, the challenges of the implementation of the PPA EVAC. Many, not insurmountable, but many. And and also when you look at those 6 key result areas, you know it's huge. And when we're talking about the time frame and how much are we going to reduce the violence from such a very high rate to at what level can we reduce it? You know, is a question that we're asking ourselves. You know, how do we target from 2018 to 2022, which is 4 years? How much can you really accomplish in 4 years? And when we're just laying the groundwork, first of all, you know, as I said, if you look at Inspire and look at all of those different programs, and you choose, you know, which programs that we are going to, you know, implement in the Philippines, because there are very few primary prevention programs designed to prevent violence against children, you know, as their primary purpose. Just the parenting, for example, to do the randomized controlled, first the cultural adaptation, then the randomized controlled study, and then after that, the scale up, and then the training of the workforce, and the planning on how that's going to be scaled up, and that's just one program. You know, I'm looking at 20 years. I'm not looking at 4 years, you know. But there are programs existing with regards to the services, the response services. In the Philippines, at least, when we talk about response services to those who have already been victimized, that is more or less already in place. So we have women and child protection units in hospitals. We have women and children's desks in police stations. We have competency enhancement training for family court judges, you know, and so forth. So the tertiary response is, in a sense, already set. But we know that tertiary response does not, you know, really go a long way in terms of reduction of prevalence. I mean, it stops the existing and maybe prevents a future recurring violence, and maybe in the next generation, but you know, but it will take a while. So as I said, there are many challenges, and we're just taking it one step at a time. And the first step, we're doing the different researches actually simultaneously. We're doing the parenting, we're doing the life skills, you know, we're doing the trauma focus, TFCBT, adapting it to the Philippines, and now the strengthening the workforce. So things are being done simultaneously, but I know this is going to take years. Okay. Now, in terms of the question about the boy child, why we have more boys who have been sexually abused than girls, I know that that probably will also need another study. But right now, our theory, first of all, the perpetrators of these boy children majority are also men. Okay, so majority of the perpetrators in the child sexual abuse of both boys and girls in the Philippines are men. And when you look at the younger children, it's relatives, and then the older children, then for boys, it's older men. And for girls, you have peers and older men. And so we feel it's because, and then I also give the mic to Kirsten, that it's because boys really are less supervised than girls in the Philippines. Boys think that, you know, they cannot be, not only boys, but most people think that boys cannot be abused. And there's also that there's some practices that may put boys more at risk, like when you look at little boys walking, suddenly someone might touch that boy's private parts. And people, if it's a young boy, people think that's okay, so there, but we still need to do a lot of research on it. We feel that this is not a phenomenon that's just in the Philippines. So I'll give the mic to Kirsten.
Yes, I mean, I just to step in on that question, I think you've raised a very interesting point. There's some very interesting trends coming out of the research on violence against children in especially this East Asia region. When I was working in that region, in what is significant about the 3 baseline studies, surveys that were conducted in the Philippines, in Cambodia, and in Laos, all revealed higher percentages of sexual violence against boys than girls. So we were all quite surprised to have these findings. But when you look at that research even more in detail, you will also notice, because we use the same methodology, the CDC-supported methodology and questionnaire, so they are pretty much comparable in many respects. What we also discovered, there were 3 separate questions related to violence. One related, did you experience violence of, for example, sexual violence? 2, did you report that you experienced sexual violence? And 3, did you get services to respond to that? And when you look at Laos, Cambodia, and the Philippines, for all 3 of them, we had, of course, slightly more boys than girls reporting that they had experienced violence. But then when you ask them, did you report that you experienced sexual violence, we have a much bigger percentage of boys reporting than girls. And then when you ask, did you get services for that type of violence? Again, it was much more significantly the boys receiving those services than the girls. So it is definitely something that needs to be looked at more closely, because there might be a reporting issue, there might be cultural issues, there might be gender dynamics as to why girls don't feel, even though they have experienced sexual violence, even though they why they're not perhaps even saying they're experiencing it, why they're not even reporting it, and why they're not even, and therefore not getting also the services they need. So there's definitely more that needs to be analyzed, but certainly very interesting findings that are coming out from that region.
In terms of methodology, I'll go to Vishanti's question because it's about methodology. The Philippines methodology differs from Laos and Cambodia in that it was not face-to-face interview. In the Philippines, it was paper and pen and self-administered. But actually ours, the boys reported less than the girls, and the boys received less response to the reports than the girls. And when we analyze, we have a child protection management information system in the Philippines. We have our database. When we did an analysis of our database, we find that the boys who consult at the child protection units are younger boys, that's 9 and below, whereas the peak age for the girls who are reporting is 13 to 15. So there's also a difference in the age in terms of reporting and seeking care. So I hope I answered your question about methodology, Vishanti. And then when we look at standards, the question of Evelyn, when you look at standards for social work, of course, when we talk about the social service workforce, it's larger than and wider than just social workers. We have different kinds of workers also. That's why we have the para-social work group during lunch. And so while we have a well-developed social welfare education in the Philippines, in that there is a 4-year course, and then you need to take an exam, to be a registered social worker. You have to pass that exam. And there's, of course, a master's of social work, and there's a doctorate in social work in the Philippines, and there's a lot of universities offering social work. But when you look at the practice, I think, especially in child protection, the standards are not yet that well set. So I'm very happy that the Department of Social Work is taking that on and working with all the different professional social work groups to be able to set up that standard. And we hope that it will include also the other members of the social workforce, not only the social workers, but they'll start with the social workers. So right now with the child protection social workers, we have a separate training program for them because it's not included in the 4-year course. So it's 4 weeks for social workers, but we're now expanding it to 6 weeks to become a child protection social worker. But you have to be a registered social worker before you can go into this child protection social worker certificate program. With regards to the emergency response, I did not include it in my presentation, but in the whole Philippine Plan of Action to End Violence Against Children, there is part of it is really in emergency situations. So it is included. So the emergency response is very much included in the Philippine Plan of Action to End Violence Against Children because the Philippines, I think, is a third in the world in terms of disasters happening. We are in the rim of fire. We have volcanoes, just exploding here and there. We have typhoons. We are, we have everything, both man-made and nature happening. So we say, I survived living in the Philippines. And yes, I guess that's all the questions so far. Are there any from the online?
Okay, the question is, the programs that you presented, have any of these been initiated yet? And if so, what are you seeing so far with respect to ability to implement them and effectiveness of those programs?
Very nice questions. In terms of the programs that I've mentioned, yes, we're already, some programs are just in the research level. So I'm talking about, while there are parenting programs definitely going on all around the country, I mean, it's been there. But when we talk about evidence-based parenting program, it's a different story. So with regards, for example, MAPA, which is our adaptation of parenting for lifelong health, we've done the RCT using the conditional cash transfer. So one of the conditionalities in the conditional cash transfer in the Philippines is that the recipients undergo the family development sessions, and part of that is parenting program. And so that's where we place the parenting for lifelong health. And the results of the RCT has been very encouraging. It has decreased harsh parenting significantly. And also the behavior of the children also have improved. And so we are very happy. So we're now expanding the RCT to 4 other regions. And in terms of life skills, I think I presented in the last symposium of the Alliance last year, our Safe Schools for Teens, which is part of it is life skills. And that's work with the Department of Education for grade 7 and grade 8. And the results of that pilot has reduced offending behavior and victimization by half, the same with bullying. And now we're expanding that to 2 other provinces in the Philippines. And with regards the women and child protection units, there are now 94 of them in 51 provinces. We still have 30 provinces to go, and that also has been evaluated and has been shown that it is effective. And so, yes, those are just some examples. Other questions? Yes.
I was wondering if you could also, because I know obviously you presented to how strong the social welfare system in the Philippines is. So if you could speak more to sort of how you ensure coordination between the national level all the way down to the community levels, both in just coordinate like best practices and lessons learned around coordination, but also in continuing to build capacity at each level.
Yeah. The problem, I'll start first with the problems. The problem in the Philippines is that while we are not yet a federal system, but if the precedent is followed, we will be going that route. But then local government is devolved. So in a sense, they're operating almost independently from the national government. So while you have the national, for example, the Department of Social Welfare having these policies and regulations, they still have to, work with local governments that it be implemented. So, so the work, while there's work with the national, there should also be local work. And I have seen the difference, for example, if you have a really well-motivated mayor, so we have another study that we're starting, which is the Evidence for Better Lives study, looking at all the different factors that influence child development. We're doing this with the University of Cambridge and 7 other cities in the world. And so we're using this city of Valenzuela, and a very well-motivated mayor. He will provide a budget that is needed for the different programs that need to be supported, very open to all these policies and regulations, and you see it working. But on the other hand, you could have a mayor who still denies that there's even child abuse going on in his city, and says there's no need to have any of these programs. So the readiness of the political leader to take on, this Philippine plan of action is still critical, although we have it at the national level. So while we have that big coordinating body at the national level, which is the Council for the Welfare of Children, their influence only goes as far as the region and not yet like per city, So when we talk about the key result area 6, which is about really the structure of this child protection system, it talks about, for example, the local protection, the local council for the protection of children, which mimics the structure of the big national council. And we're looking at how to operationalize all of those local councils. Because right now, the assessment is that maybe only 10% of them is functioning. And so how, a lot of it is also because of the political structure. You have the head of those local councils are elected every 3 years, and you may have new membership every 3 years, and how to go about, having the continuity, especially if you're talking about training of new members every time, is really mind-boggling, and we feel that maybe there should be a better system. But I think the strength in the Philippines is that people are now aware, very much aware about interagency work, and having all of these different agencies sitting together and working together. But my own experience with this is that, yes, communication, coordination, working together it really goes a long way in terms of interagency work. But there is still a lot that needs to be done within the agency itself. Because when you talk about budgets, you're taking that from the agency. There is no budget for interagency budget. The budget comes from still the individual agencies, and how to manage that budget and that who should be the lead in terms of those different councils, is really, it's a fine line, to be able to manage that. So for example, for child protection units, which are multidisciplinary teams with a doctor, social worker, police, psychologist, we chose the health delivery system, but it has contributions from, say, the department, from the local government, social welfare, from the police, but the backbone is health. So it has, for us to work, there still has to be, you still need to get a lead agency that will take it on. Any other question? Okay, no more online question? Okay, then we're done. Okay, thank you.